passionate about supporting aspiring entrepreneurs and facilitating collaborations among faculty, students, and members of the local community. Our chancellor here at Penn State Lehigh Valley, Dr. Tina Q. Richardson.
Thank you, Liz. And thank you to all of our sponsors. We are here today to have yet another LaunchBox event. Today's focus is going to be on businesses that have innovated and pivoted amid COVID-19. We all had to shift in some way how we function in our lives, but as a result of the pandemic. But at a time when so many businesses were unable to operate, our three panelists today, they went to work using innovative ways to continue their business and to transform their entire enterprise. They found ways to match their evolution as a business to community need. Truly, they are aiding the fight against COVID-19 in very significant ways. And as such, we have them here as leaders today to engage us in a conversation that will shed some light on how to execute in short order in the midst of challenge. And we have Liz here, Liz Kepner, to facilitate that discussion. So let's jump right in, because I'm really excited to hear how these individuals were able to transform their businesses to meet the needs of the community. So thank you for joining us.
Thank you, Dr. Richardson. Well, I'd like to introduce our first panelist, and that is Ralph Schlake. He is the president and CEO of Applied Separations in Allentown, which has grown tremendously since its modest beginnings, boasting consistent growth and technological advances, which show no sign of stopping. Ralph was a pilot in the U.S. Air Force and a Vietnam vet. He is also a clinical chemist with several patents. Our next panelist is Ron Belknap. Ron is the co-founder, president, and CEO of Protocam in Allentown. Protocam not only explores, but helps develop and fine-tune the latest additive manufacturing technologies. Ron has worked at several different companies in his career in various manufacturing roles and is passionate about finding better ways to produce a quality product. And our final panelist has really pivoted during this global pandemic. Chad Butters is the founder and CEO of 8 Oaks Farm Distillery, which grows all of their grains either on site or on the farms of friends and neighbors. And those grains are then handcrafted into a number of spirits. Chad is a retired Army aviator with over 25 years of active duty military service. He is passionate about family, agriculture, and science, which led to the creation of 8 Oaks Farm Distillery back in 2015. Thank you all so much for joining us this afternoon. I think we're going to start with Chad because I feel like you have really made the biggest pivot. Can you talk a little bit about that? Introduce your company and talk about maybe what you did before COVID-19.
Thanks, Liz. Appreciate the introduction. I'm sure that everybody has certainly pivoted to the degree that they needed to in order to meet a demand, and I'm grateful to be part of this this discussion. So thanks for having us, number one. But yeah, our business typically in normal times is all about growing grains, wheat, rye, corn, and barley, and turning those grains into bourbon and rye whiskey and vodka and gin and things like that. So our establishment was very much a place for people to gather, which is exactly what we don't necessarily want right this minute. So yeah, we did have to make that that pivot to something else, and I'll be glad to describe that in as much detail as time allows and people's attention to.
All right, thank you, Chad. Ralph, how about you? Talk about your company and what you did before COVID-19.
Well, thank you very much, Liz, and thank you for the opportunity to talk about Applied Separations, our company. We're we have not made a substantial pivot like Chad has, but what we have done is previously we were a manufacturer of laboratory scientific equipment and processing systems in an environmentally friendly technology called supercritical fluids. That was one half of the business. The other half of the business, we were involved with the DNA and RNA testing. And this has been quite focused in some of the work that's going on with COVID-19. Whereas previously we had worked in a completely different area of DNA, now we are kind of focusing in the areas of the actual COVID testing.
All right, thank you, Rob. Ron, what about you?
Thanks, Liz. Appreciate you having us on the panel here. I'm obviously with Protocad. We're located on the western end of Allentown. We're an industrial 3D printing company. We have all the processes that are available for printing plastics in-house, and it was a natural pivot for us to bring in producing PPP equipment, because with 3D printing, we can print pretty much anything, and we, in-house, we have all the processes. We have urethane castings in-house, we have finishing in-house, and so it just made sense for us to help out in a tough situation.
Ron, when did you decide to make that decision? Because we all talk about, before COVID and after COVID, what we're experiencing right now. When did you make your changes?
Well, we were actually contacted by a couple local hospitals to ask us what we could do to help them out. This was way early in the process, and their concern was, are they going to run out of supplies? And knowing that we could produce pretty much anything, we were set up with those two hospitals to make supplies in case what they had ran out.
Ralph, what about you? When did you make your changes?
We didn't make the decision quite so much as it was brought upon us, but a couple of things that I think that are important that I think we did for the community, not so much a pivot, but recognizing that the community was in short supply of some of these PPE products, this equipment. We use this material in our production itself. In order to go ahead and make a DNA product, we've got to do this in an ultra clean room. And as a consequence, we need these PPE kinds of material. These suits are vital for us to go ahead and maintain cleanliness. Now, typically, however, when we come out of the clean room, when our workers come out of the clean room, we just go ahead and discard this. And that was a terrible waste, especially when there was such a requirement, such a shortage of these. So we had our team put together an opportunity, a little bit of a program saying, can we reuse these? These may not be sterile, but what we can do is perhaps come up with a process, quite simply, just to go ahead and bring the temperature up on these suits so that we could go ahead and kill the coronavirus. So that's what we've been doing. So what we wind up doing after each shift, we go ahead and accumulate these gowns, put them in the ovens, and then go ahead and package them. And then we offer them free to anybody that has a shortage. So we've given them from a wide variety of first responders to the various hospitals to even custodial people that are working on to clean a particular apartment, for example.
That's wonderful. Thank you, Rob. Chad, I understand you were, outraged at how much sanitizers were, going for, and was that part of the idea to, start producing your own sanitizer?
Absolutely. Outrage, I guess that's probably pretty accurate. March 14th was the day that I was scrolling through a news feed and saw that some people had bought like 17 or 18,000 bottles of hand sanitizer, and they were selling it for $320 an ounce. Not just them, but if you went online at that time to buy hand sanitizer, that's the prices you would see, is somewhere around $320 an ounce. A national emergency had just been declared at that point, if you'll rewind the clock to March 13th or so. And it was, to me, it was just not the time to be taking advantage of that kind of situation. So we set out to try to be the antidote to that, the exact opposite of that. So on Sunday, I guess that would have been March 14th, we had kind of a team meeting with some of the leadership here to discuss what it was that we might be able to do for the community in this environment. And having just read those news articles and understanding that hand sanitizer is made mostly of high-proof alcohol, which we had gotten to be pretty good at making, we just, we refer back to our purpose, vision, mission, and values, and we apply it to this environment that we're in currently. and we say, what can we do to take advantage of our skill set, our property, plant, and equipment, and execute the purpose of our whole company. Our purpose is at the heart of everything we do. We want to make a positive impact on our community. So looking through it through that lens, we said, we think we're capable of making this hand sanitizer. We think we can make that adjustment. We had an emergency board meeting that night, March 14th, to make that strategic decision. And Monday morning, went in, talked to the entire crew, said, this is what we're going to do. And by 12:57 Monday afternoon, we had our first batch of hand sanitizer. So it was a very, very quick turnaround, but it only produced a little bit. We weren't sure of the demand at the time. We just knew that it was needed. And really, we set out to just protect our nonprofit partners that we work with every day, people like Cancer Support Community of Greater Lehigh Valley. And we just wanted to get hand sanitizer to them at no cost. But when we posted this stuff on Facebook, it really did blow up. And it culminated in CNN, spots, and Washington Post and Popular Mechanics, and really kind of exploded from there. But importantly, the lesson we learned was how critical the demand actually was. We were getting phone calls from Department of Defense, from Department of Homeland Security, from every regional hospital, all the first responders. We just got flooded with contacts saying that they desperately needed this hand sanitizer. So that was the light bulb moment that kind of let us know that, hey, this is really required, it's desperately needed, and we have to do all that we can in order to scale up production. So I'm happy to say that from that point, it took us about 2 weeks to make about 5,000 8-ounce bottles. And at this point, we make 4,000 gallons per day. So we've made a total of over 30,000 gallons worth of this product at this point, and donated completely for free to first responders in 7 counties that surround us, and really throughout the nation, with over 100,000 8-ounce equivalents of hand sanitizer for free. So it's been an incredible just project to work on, and we've been really proud to do it.
It sounds amazing, but there's got to be some challenges too. I mean, because it's, everybody was on board, but at the same time, you don't just start making this in mass quantities. I mean, how do you, and then while you're still doing the spirits?
Well, we made a decision to stop spirit production immediately and focus 100% of our resources on this. But yeah, thankfully we were ignorant to how hard it would be, because had we known, we may not have done it. But the supply chain was critical, and I'm sure these other gentlemen would agree. The supply chain is what really cost us time. And in this environment where you're trying to scale up production as quickly as possible, it's not about time as a profit motive. It's a time because exponential, the disease is increasing exponentially daily. So you have to get this out as quickly as possible. So managing the supply chain and getting a supply chain that we were not used to utilizing, those glycerin was not something that we knew about. Those types of bottles were not something that we typically sourced. So getting that supply chain intact took a good 2 or 3 weeks. And a lot of it was because what we were receiving or what we needed was overseas. And so, I think this is strictly opinion, but I think as we move forward, you look for the opportunities and the silver linings out of all this. I think U.S. manufacturing is going to be something that we certainly take more appreciation of. And I think, frankly, things like farmers and local butcher shops and, local places to buy eggs and milk, these local farmers have really, really stepped up and taken care of their community. So there's a lot of goodness that's going to come out of this and stay with us for a really long time.
Now, Ralph, you were shaking your head. Did you have supply chain issues as well?
Well, I think we've all had those issues. The mere fact that we were designated as a life-sustaining industry or business gave us the opportunity to maintain our staff and continued working. However, just because we're capable of doing that, we have to put things together. We have to manufacture, and that requires raw materials. Not everyone was under the same set of circumstances. So we had to look for multiple alternative suppliers. We had to go ahead and find some alternative ways of doing things. So yeah, it required a fair amount of changing in terms of some of the basic protocols that we follow.
Ron, what about you?
Yeah, because I mean, we didn't make masks and face shields before. So something as simple as buying the strapping material for the mask. We you know, because everybody was doing it, so we had a hard time finding that stuff, and we really had to, you know, dig down deep, and everybody around the facility, you know, use their resources, and we did finally find some. But I was amazed at the challenge we had at getting something that simple.
What about the retention efforts with employees? How are your employees doing? Ralph, let's start with you.
Well,
Just a little bit about them. Mhm.
I think there is a many of our people are used to working in a clean room and a clean room environment. You know, so we have a little bit of an unusual set of circumstances. We're used to these PPE, we're used to masks, but not everywhere in the facility. So we had a number of people, I think, that just like all workers, have some kind of trepidation about actually coming to work, because they may go ahead and infect, you know, get infected, and or other workers may be infected by some of their coworkers. So there was a challenge all the way along. So way before many of the guidelines were established, what we wound up doing, because we have experience in that area, we immediately began to put some of these practices in, or these procedures in practice around the company. We did the isolation. We trained everyone in terms of wearing masks. We don't necessarily have PPE equipment on everyone, but we're located on 4 different floors. So as a consequence, we cut that communication out. All the meetings went to the telephone. And I think as a consequence of that, we developed a feeling of security in the facility, so that our workers had the opportunity to come to work and feel safe that they weren't going to go ahead and have any kind of an infection as a consequence of coming to the workplace. Now, from that as well, we ensured that the building was closed, limited access. We still do not accept any visitors. In fact, the postman has to call, and then we will go down and pick up the mail.
Lots of things are changing. You know,
Yeah.
we have to roll with the punches. Ron, what about you? Did you have a similar experience? Were your employees, you know, first on your mind of keeping them safe?
It was. Yeah, I meet my employees, you know, daily or weekly, whatever, to make sure they're up to date. And we had, you know, multiple training programs to make sure they understood the situation and how to stay safe. And I really, you know, enforced on them that, you know, one person comes in here with a virus, you can shut the whole place down and affect everybody, you know. And, you know, I had made a commitment to my employees not to lay anybody off if it was possible. And, you know, they respected that. And when they realized that they were making some safety equipment for healthcare workers, that even adds to the motivation of the employees.
I agree. Chad, I think you probably feel the same way, because when you approached your employees with what you were going to be doing, I mean, from going from making spirits to making hand sanitizer, they were all on board. They said, let's do this. And they knew that it was important, and the community would appreciate it, and they needed it to keep them safe.
Yeah, absolutely. I think, you know, when you have times like these where everything, especially in the last couple months, where everything was very uncertain, right? The thing that that helps a lot is to have a consistent goal, a consistent mission, and consistent priorities. So we certainly had the goal of producing hand sanitizer to anyone, you know, for anyone that needed it, especially those in mission critical roles in our surrounding community. That was our goal from day one. It's still our goal today. And then the priorities is protect the crew health, number one. Number two is protect the viability of the business. So make sure that we can stay in business in this time, in the short term and the long term. Number three was protect our crew's paychecks, you know, protect their way of life, their source of a living income. And number four was serve the community. So I think if you have a consistent goal, a consistent mission, and consistent priorities, then you can flex to kind of adapt to the new environment, whether that's regulatory. I know on our side, we have the FDA and the TTB that oversees everything that we're doing as far as hand sanitizer or spirits production. Not so much FDA on the spirit side, that's TTB thing, but whether it's compliance or government orders for stay-at-home orders or changes in what we're allowed to do or what we need to consider. Those are much easier to take on if you have that consistent goal, consistent mission, and consistent priorities. And then you keep the communication open. So I'm proud to say that, our team definitely stepped up. We have bartenders and distillers that turned into hand sanitizer producers and bottlers and came into work every day with that sense of mission to get this job done. And we started with 25 and now we have 30 actually. So we've hired 5 people in the course of this. So I'm super proud of the team, of course.
We just want to remind our virtual audience to utilize our Q&A feature to ask questions that you have for our panelists. Remember, they took time out of their day. They're very busy, as you can tell, but they would love to answer your questions. So Ralph, let's start with you on this question. How do you see the future for your company now?
Well, I think our growth going forward will continue. We've had a bit of a setback with a lot of people not going. Much of our business is into laboratories, but with a lot of people spending their time at home, we have had some of our orders pushed back. So as a consequence, people are not in the laboratories. The workers are not in laboratories, which is our market. So some of the testing has gone down. We expect this to come back. One of the areas that is quite interesting, I just hope that the level of enthusiasm that we have seen for the technology by people being at home doing research, we've had an incredible number of inquiries. I would just be, in terms of understanding, trying to figure out what's going on with the technology and whether or not we can go ahead and provide some solutions. Now, I only hope that a small fraction of that kind of results in orders.
All right, Ron, what about you?
We were in a growth mode until this thing happened, and we've obviously slowed down. We're down probably 30–40%. But considering the visibility that 3D printing has gotten through this crisis, I mean, people are realizing that you can utilize our technology and make pretty much anything. And because we're now using production grade materials, that's why we could print masks and face shields and like that. I expect when this thing opens back up and people come back to work, I think we'll be going gangbusters. I'm very confident about our future.
Chad, what about 8 Oaks? I mean, are you going to continue to make sanitizer? I mean, can you make spirits and sanitizer? It sounds very very difficult. But from what we're hearing, it sounds like you guys can do just about anything. But what do you see for the future?
Well, again, our mission was to produce that hand sanitizer for those in need and the mission critical organizations in our surrounding community. And I think we've met that mission at this point. We literally are bottling today. We might have one more bottling to do either later this week or early next week. And I think that'll wrap up the hand sanitizer production for us. I think we will have met our mission. And over the last couple of weeks, we've started to transition into this incremental approach back to beverage alcohol and spirits, doing e-commerce and online sales for curbside pickup. Today, we just launched delivery within the 30-mile radius. We're doing shipping as well. So what's really interesting is the opportunities that present themselves in these unique environments are just things that you have to kind of flex towards. We did 0 e-commerce in the last 4 years, maybe $600 worth of hats and shirts or something like that. And we've done well over $100,000 of e-commerce in the last 4 weeks. So, that was a channel that was completely closed to us, and now it's very much open. And so there's some benefits to that for sure that we certainly want to take advantage of. So that's where we're focused on, kind of those incremental things. I don't see life as pre-COVID and post-COVID. When the disease is gone, it's going to return to normal. I really think that our business is impacted, and I think probably lots of businesses are impacted forever. But not necessarily negatively. There are definitely things that we're doing now to prepare for reopening that will provide our customers with even better experience because of this. So we live for, instead of having a calendar where we would plan for July or August or into the holidays, our calendar is now just event driven. So what are the events in the world that are going on? And based on those events, what does that allow us to do or not do to make sure that we provide a really great experience for the customer, while also obviously being very safe for the customer and for the crew. And so those things are interesting because it's strategic decision making every single day at this point. And that's kind of fun, actually. It's nerve wracking, but there's a lot of joy that comes out of that. So just real briefly too, I wanted to say to Ron, what's been interesting is even within our own communities, we get to help each other out. So we actually have some masks that Ron's company donated over to us. I hope you donated them. I didn't.
Yes, I do. Yeah. Well, my son's his friend with one of your co-owners, so that's how that happened.
Oh yeah, I'm familiar. So I was going around with my American flag mask on. I've got it downstairs. I should have worn it to this thing.
There you go.
I think Ron wants a bottle of, Applejack or something in response. Maybe you can get that to him.
Yeah,
Hey, that's only fair, Liz, right?
yeah. Hand sanitizer and some stomach sanitizer coming your way.
There you go.
So it sounds like you have all three of you have really embraced this change with e-commerce and the way that you handle operations at your companies. So what about I'm sure you have friends, I'm sure you know people that are struggling right now. What would be some advice that you would give them? Like you said, Chad, taking this opportunity to, not really saying this is post-COVID, this is what's going to happen after this is over, because we don't really know when it's going to be over. So we have to adjust. So Ralph, what would you say to some of those business owners who are really having a difficult time right now, trying to reorganize their strategy?
Well, I think one of the things that we've come across is, and that's in our overall business anyway, is that with the scientific areas, things change constantly. Nothing is in a static mode. And I think this has demonstrated the fact that COVID has demonstrated the fact that many things change and you've got to pivot accordingly. This too will come to pass, as the old expression goes. And I think the only thing you can potentially go ahead and say to those businesses, see where there is an opportunity to go ahead and find a different niche, find a different area to work in that is closely analogous perhaps, or completely something different, but keep plugging away. That is don't stop. You will manage to get through this.
Good. Ron, I know you probably have some words of advice as well.
Yeah, I think if you could just hold on for the short term, once this thing opens up, I think you're going to see a tremendous boost to the economy. And because we were having trouble filling jobs as it was before this started. And just like Chad, he hired some more people. I think you're going to see a tremendous hiring going on if somebody's looking for a job. And I think most businesses will do well. And we've all learned to work more efficiently. I mean, I have half my office working at home right now. I was never a proponent of that, but it's actually working very well. And I mean, I have a great staff here, so they made it work well. And it's almost working seamless. So, we'll come out of this a more efficient company, and look forward to the future.
Chad, we're going to finish things up with you before we get to the Q&A. Your advice, and also I just want to let everybody know in our virtual audience, your e-commerce is up. You can buy the spirits online. You can also buy the hand sanitizer as well. Locally, can we go somewhere? Do we just buy it online, or can we do both, Chad?
Yeah, well, I appreciate the plug. Thanks. You can just check out our website, put that in the Google machine, 8 Oaks Farm Distillery, and then it'll take you to an online store where you can purchase any number of things, including hand sanitizer. And our thing with hand sanitizers, really, it's kind of 3 channels that we're using. So certainly business to business, as these businesses start operating, they're going to need, sanitizer to clean their surfaces and their hands. So we have an outlet for that. We also certainly continue to have an outlet for the emergency responders, nonprofits that's completely donated again. So there's an outlet for that. And then to the individuals, the families and individuals out there within our region, they can, purchase it. And our commitment is to continue to keep that at a very, very affordable price. So, $15 for 64 ounces, I would challenge you to see that anywhere. It's more about getting the sanitizer out there. So, but to your question, thanks for the plug. But to your question about, you know, advice for other business owners, I think to me, it really does start with purpose. And that seems simple. You know, what is the purpose of your business? Seems like it might be a simple answer to that question, but I think it's a very difficult one, and it's one that requires some soul searching to a degree. So I think to have that conversation with yourself or your team about what is the true purpose of your business, and then have a vision and mission for your business, and then see how it applies to the current environment, whether it's the COVID environment or whatever is next. But you know, you got to have that framework in place to first have that, understand it, and then see how it applies to your current environment and make those small adjustments required to maximize your efficiency within that environment. I think that would be my advice.
It's great advice from all of you. So we do have some questions from our virtual audience. Whoever wants to answer this first. Will your businesses continue with the COVID changes going forward? How will you adapt? And will you expand your product lines?
I can answer some of that. We've had a number of inquiries, and these are some rather unusual areas of inquiry. For example, we're doing some research, and we've provided a system using this newer technology to actually go ahead and clean some objects that were previously perhaps maybe infected with COVID that are not so easy to go ahead and clean. For example, it's very difficult to go ahead and put a hand sanitizer, if you will, on money, on folding money. So what we have, we've supplied, and we've done some research with another company that is looking at cleaning money using this technology, and i.e. cleaning the COVID virus from money.
Those are things you don't really even think about.
Exactly. So it's a little bit difficult to go ahead and do that without going ahead and changing all of the characteristics of the money. That is the anti-counterfeiting measures and all of that that's associated with money. You just can't throw it straight into the washer and expect it to come out in the same fashion.
Ron, do you have anything to add?
No, I mean, I see us, you know, just moving forward with the existing business. You know, once we're done making the PPE stuff, you know, we'll go back to 3D printing and off we go.
So we kind of touched on this before when we talked about some advice, but what about small business owners, you know, trying to innovate, seeing this innovation continue when the stay-at-home order is completely lifted?
I guess I'll jump in on that one. So again, you know, with the purpose, vision, mission kind of values kind of conversation, having just, you know, kind of gone over that, I would say that as business owners too, you really, really have to stay tuned in to compliance and law changes and things like that. You know, governmental changes, whether there's bills or laws that are on the books that are coming that impact your industry, you know, staying in tune with your industry through trade associations and magazines and things like that, and just simply getting as much information as you can to see where there's areas of opportunity for you. I know for us, a lot of times that's in a highly regulated industry like ours, it's all about governmental affairs and what's coming down, what are the changes. You know, we just had a change just 4 days ago that we can do to-go cocktails now. Which is a significant change that changes our business. And I think it's very difficult to put those genies back in a bottle after you've let them out. So I don't think it's a temporary change, but those things for us, a lot of times come down through government, you know, government affairs and watching the legislation. So I would certainly suggest that small business owners within their industry look for those opportunities.
Ralph, we have a question for you. It's interesting how you recognize the waste of discarding your product before. Will you be continuing this reuse practice going forward?
We would certainly go ahead and offer this to people. We continue to provide all of this. If there is a no issue in terms of supply. People can go ahead and get their PPEs as they had previously. It's a supply and demand. If they no longer have that opportunity to get the supplies, then we will continue to supply them, as we are available to supply them.
Ron, maybe you can answer this question. We have a number of questions. This is great. Have other companies in your field reached out to you for advice? And if so, did you learn anything from them?
Yeah, we have. Matter of fact, one of the things that it's interesting, there's various 3D printing processes available, and one of the things that became very evident was, just because you can print it don't mean you should, because like the masks, a lot of your home-based 3D printers, you can print a mask, but it's not safe because it's not an airtight mask, and so we've been in contact with several different companies, and they're learning that, certain processes are only good for certain situations, because we were committed to making our products 100% safe. It wasn't right to put out something there just because we could print it and not have it safe for the user. So we actually went through extensive design on the mask to make sure it was airtight, to make sure it sealed to the face, make sure we had a proper filter, and it was comfortable because like Chad said, you wear these things for hours and hours, and it better be comfortable. So. Yeah, we've talked to a lot of people, and some people probably weren't very happy, but the facts are what they are, and safety is first in this situation.
Well, one of our audience members loves the positive attitude from all of you. What do you all do personally to ensure your psychological health? Because you are dealing with a lot of changes right now. On top of working from home, and deciding, when is this going, not I say to end, but when are things going to go back to what we're doing, if we're changing it? A lot of things are going on right now. So how are you staying healthy mentally?
I'll start to answer that question. One of the things that motivates me is, as I mentioned earlier, I was committed to make sure I didn't have any layoffs in my facility, but we have a real family operation here, and I'm committed to keep my family safe. When I say family, it's my employees. I mean, when we started out, I gave everybody gloves. I gave everybody gloves take home to their spouses, and they had masks take home, and I bought extra sanitizer to take home and keep the entire group safe. But I feel good about making sure that my employees, come in the morning and they're educated and they are staying safe. And the nice thing is they've responded by doing that. I mean, we've had no cases in the facility. They've all followed the rules about, going home and staying home on weekends and stuff like that, and it feels good when you can take care of your extended family and keep their livelihoods going during this situation.
Ralph?
I echo exactly the kind of things that Ron had as well as said. We also have provided, obviously, the masks, the hand sanitizers. We've got some capability because we have some of the chemicals here in our laboratory. So we've gone ahead, certainly not to the extent that Chad has done, but we've got some of that. We repurposed some of it, and we could go ahead and make some of that for our own individual workers. But, to ask what the positive attitude is, I might address that in some fashion along these lines, is my mother, God rest her soul, would come out of the grave and says, "You better do it."
Motivation.
It's the old image of the immigrant from the old country that said, "That's your responsibility. You had better measure up and do it."
I have a grandmother like that too, probably would be saying the same thing. Has anybody, I mean, this is a little, I guess, off topic, but has anybody picked up any hobbies or anything that they're doing more to try to stay, calm and relaxed? Ralph, you're shaking your head no. You're not baking bread, you're not.
No, as I indicated, our workload from the point of view of answering questions about the technology has just mushroomed like crazy. And that has really kept us busy. Again, I only hope, as I said previously, that just a small fraction of this turns into business.
Right, right.
If I could jump in there on that one, I saw that question from Denise, and I appreciate the question. It's actually a really thoughtful, question about all of this, I think. And a couple things come to mind. One is this kind of concept of, if you don't like a situation, you have two choices. You change the situation or you change the attitude about the situation. So you have to just kind of have an attitude that you can adapt. I think there's people that are better at that than maybe some others sometimes, but it really all comes down to attitude. And yes, it's kept us having a mission focus and having something that you're getting up every single day to go, and what the goal is, what the mission is. I think that's very helpful for the crew, the entire crew, to feel like they have that sense of purpose, and that helps psychologically as well. And then now we've been doing this for about 2 months, really just straight work. We finally this week have started rotating our employees on a week on, week off basis, so that everybody gets 1 week paid time off. It doesn't come out of their vacation time. It's just a decompress week. And I think that's really going to help everybody. I'm looking forward to my week, I know.
That's, who knows what you're going to do. You'll probably still be working though, Chad. I don't see you taking off. I see it always working.
I think I'll take off. I think I'll be fine.
Okay, great. Somebody did ask one of the questions. I think we answered this, but are you still making spirit? Are there spirits available? Like somebody said, my question is, Chad, back to making spirits, but there are, with your e-commerce, you can buy these on the online store.
Yeah, that's correct. We are officially back to making, actual beverage alcohol spirits at this point. About 2 weeks ago, we started that. So right now we're running parallel in conjunction with spirits. We're also doing the hand sanitizer. And as I mentioned before, the hand sanitizer really will probably be finished by the end of this week. And we'll completely divest of that and just focus back to beverage alcohol and to getting our hands wrapped around kind of these new channels that we're using to get our product out to people.
Okay. The last question that we're going to take before we have to wrap everything up, and I think you all have touched on this. What changes in culture and in company operations that have occurred during COVID-19 do you see going forward, well past the current crisis? Let's end with this. Ralph, start with you.
I think the culture of, although I think we've had a pretty tight-knit group, we have come to appreciate working together much more so, and looking at other opportunities outside the immediate markets that we serve. And some of these may be in areas of clinical, where we can go ahead and work perhaps in the COVID area and help out in that particular area. But I think one of the things that we have generated from this is the product that we've given to the community. That is, through the cleaning of the PPEs that we've offered. I think that's given our coworkers an understanding that we are all part of the broader community, and that we should become part of that more fully.
Exactly. Ron?
Yeah, it's interesting. To kind of add on to what Rolf said, that it's interesting how the employees have grown closer together amongst themselves, because they're working as a team to get through this, to stay safe, and they see the efforts that as a company we've been doing to bring everybody through this. And even like I have half my office working at home today, and it's interesting how even they have I think even though they're away, they've grown closer as a team. We do Zoom meetings, of course, every week, of course, and I mean, we've always had a great culture here, but it's interesting. I think this is going to improve it and to make this even a tighter group yet.
That's right. Chad, it sounds like it's the same way with you as well.
Yeah, absolutely. I think, that's the reason that culture is so fundamental to your business, is because it withstands the the run-ins with uncertainty like this. So if you have a culture that's already created, it's super important that you create that from day one, so that you weave together this fabric of a crew that when times get tough, the crew doesn't just disintegrate. So I think between a culture and then between information, continuing to keep people engaged, that very certain goal that everybody is working towards, and consistent priorities, I think is what provides people the consistency that they need in order to feel confident in what they're doing.
Well, I think it starts from the top, and you are all exemplary leaders. You really, it sounds like you care about your employees, you care about the community, and we're just so happy that you could be a part of this panel today. And we could go on and on and on, I'm sure, right? Ralph, I know we could.
Thank you very much.
Yeah, I think that we probably should wrap things up soon. Again, thank you so much for joining us. If anyone, like today's program, we have a number of webinars coming up this summer, sponsored by LaunchBox Ladies. And if you want to sign up for them, you can just go to our website. That's lehighvalleylaunchbox.psu.edu. So please sign up. We have them at the end of the month. Professional services, health care and wellness, that's in June. And then also higher education. So that's going to conclude our program. Again, we wanted to thank our panelists for taking time out of their busy schedules to be with us. Ralph, Ron, and Chad, thank you so much, and good luck to you. Please stay safe. Dr. Richardson, thank you for having programs like these. And thank you to our virtual audience for tuning in and for asking some really terrific questions. We really appreciate it. I'm going to conclude our program and say I'm Liz Kepner. Have a great day, and please stay safe.
Okay, we're good.
Oh my God.
All you can do is laugh about it now.
Oh my God, how late were we? Was it a long time?
No, we were late. I mean, we started at 55, so about, I would say like 10 minutes.
So what time did Liz get back on?
12:05.
Oh, so it was only 5 after.
Yes, of one.
Honest to God, it felt like, and I was like going through my, hold on. Wait, I'm going to tell Liz. She just texted.